Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma, July 17th, COVID update. So we're going to talk a little bit more about the Delta variant and some newer reports and things to think about with that, and then I'll answer some questions. So some Delta variant updated data. I mean, the standard thing we've been thinking for reinfection with any coronavirus, SARS, COVID type has been about 10% of people get infected and reinfected after a vaccination, will get infected after vaccination, with 90% being asymptomatic and 1% being essentially mildly symptomatic to barely symptomatic. So a report out of Israel now is saying that they're seeing about somewhere around a 65% vaccine efficacy in terms of not being symptomatic or being totally immune versus 90 with the Delta variant, with that 35% being very predominantly just mildly symptomatic for a couple days. So that's consistent with what we'd expect in terms of symptomatology, but just the volume looks much bigger. And so that's a very important report, I think. There's still a 93 to 95% reduction minimally from serious illness in their report. But that's significant, and so we need to start thinking about that. I'm still not seeing lots of reports, though, from people either from Israel, in our clinic, or in the United States on reinfection with the Delta being serious in those who've already been infected. So that's a hard thing to tease out in terms of, we get lots of reports now about, or getting more and more reports about post-vaccine infections. We're not getting lots of reports on post-infection reinfection. So again, that data may come, but again, that falls within the category of what people don't want to know in terms of governmental agencies. So we may or may not get that data. So that'll be interesting to watch. But so far, as I've told you last night, of our people that we know who've gotten in my practice, and it's 5 people have gotten infected after the vaccine. Now, one of those people had already been infected, got the vaccine, and then got got infected again. So she obviously has an immune defect. So she's gonna be in a workup for that. But she took ivermectin for 2 days and was fine. And so that's what we really need to focus on a little bit, is if you get infected after, you have to be aware that you could get symptomatically infected occasionally, or 1 in 3 times, if you've been vaccinated with the Pfizer and potentially the Moderna or the Johnson & Johnson. So again, like I said yesterday, we need to be on our vitamins. We need to be taking our zinc. You need to have a plan with your provider for therapy if you do get infected, because we don't know the vast majority of people are going to just have very mild illness, very little. It is always a possibility you could get more significant disease, so we'd rather intervene for you, at least in my practice. And if you don't have anyone who can do that for you, find someone who can do that for you, and you can always look online for ways of getting those prescriptions. Long haul syndrome. Let's talk about long haul syndrome for a second. We've had now treated, or I don't want to say treat, we've provided therapies that are restorative and regenerative to systems to help people get better, because that's the phraseology I have to use. We do not treat people for long haul syndrome, because I have to use the right phraseology per the FDA guidelines. And for those of you who say I get political, why do you think I get political? Because I'm not allowed to speak English anymore about what we do. So, because it's about control. But be that as it may, but if you ever get mad at me about it, think, I've had 6 posts taken down in one strike. All of those had one thing in common. I posted published peer-reviewed medical journal articles, and they didn't want them on. So that's why I get that way. So we have to be careful how we say this. But so there's options for long haul syndrome, and there has to do with restorative and regenerative therapies, things like ozonation of the blood. There's things with vitamin therapies. There's things with potentially anti-inflammatories. One of the things that someone is going to what Kim may ask a question about is, do we use low-dose naltrexone? Yes, we use low-dose naltrexone. We use that very commonly for what we call autonomic dystonia, which is when your involuntary nervous systems are awry. And again, that's something that naltrexone's to block endorphins opioids for opioid overdose. But if you get too much endorphins or opioids at the end plate between the nerve and the muscle, that has his body effects. And this gets not super complicated, but again, you wonder about the FDA, because I'm allowed to do that all the time, but I'm not allowed to discuss it I mean, I've done it hundreds and hundreds of times over the last few years for pain, autonomic dystonia, and everything. So it's something we can use as a role to help with this autonomic dysfunction after post-COVID. I had Marcus Smith, who's a cardiologist we work with very closely at our office for POTS, postural orthostatic tachycardia syndrome, and for those of you who know what that is, whatever. So we use naltrexone for that all the time too, low dose. So there's a lot of things we can do to help people with that. So that's always something that there's availability for in our office if someone has a difficult long haul syndrome and they want some restorative therapies for an attempt to address it. But that's really what I mostly wanted to talk about. Then I was going to answer questions, but I would definitely be on your supplements and think really, really hard about a plan just in case you get infected.
Ready?
Yes.
Okay. Are you concerned?
But hold on, last second. I'm not nervous about this. I mean, if you've been vaccinated, you're in really good shape. If you've been infected, my opinion is you're in really good shape, because that's what the data shows from Fauci's own division. So again, you're going to probably be okay, but just boost your immune system and be ready.
Are you concerned about kids starting school with all the new variants? Like younger kids, I think is what they're asking.
I'm not concerned at all about kids starting school. I think when we look back at COVID, which I've said before, especially when I talking to the Edmond Public Schools leadership team, I think the data is going to clearly show that not having kids in school will be 1,000% more harmful than having kids in school. Overall, when we're looking at the initial data out of Israel, because they're having a lot more, they're better at reporting right now. Kids who are getting the Delta variant are not getting sick or are very sick at all as expected, and neither are young people. Young people, 20s, 30s. So again, kids should be able to go back to school. I don't think they should be in masks. I don't think they should get an experimental vaccine. I think they need to be caught up on their immunizations, and they need to be on their vitamins. That is my opinion on it, for what it's worth. I mean, I just looked at the myositis or the inflammation of the heart muscle stuff with the vaccine for kids. Again, little concerning. It's not a temporal relationship. That's utter nonsense. The data, when you start looking at the data, it's not an even curve over time, which would just mean a temporal relationship. It's a pulse and then a down. So no one wants to really admit that, because we can't be honest in the United States and go, vaccines have risks, and the sum of the risk is way less than the benefit, which is outstanding, in adults. So yes, there's risks to the vaccine in adults too, but the benefits are massively better than the teeny chance of a risk. And I would argue, to avoid the risks of the vaccine, what we always have often encouraged everyone to do is take fish oil for a couple days, at least some Advil or baby aspirin, and do that for a couple days before and after. It doesn't affect your immune response, but it can decrease your inflammatory response. That is rare, but can happen.
Okay. If you've been vaccinated, you're outside a lot, do they still need to be on vitamin D?
Yes. Our food sources are bad, and I want your vitamin D 80 to 100. I don't want your vitamin D at 60. It doesn't do anywhere near as much. I want it at 80 to 100. Okay. That would be a serum level. And again, you can always ask your doctor to draw it for you, or your provider, nurse practitioner, or PA, any of those people.
And is that regardless of COVID, you want it that high? Or?
Yes, I want it, but in particular for COVID, I want it that high because the prior hospitalization data showed that people who got hospitalized universally had low vitamin D, and the people who didn't get one of the things they've differentiated is people who get reasonably sick have higher vitamin D, or who don't get hospitalized had higher vitamin D and higher testosterone. So, hormones matter. They support your immune system. I won't go into that whole thing again. I don't want to go back to all the stuff we talked about in the beginning, but some of that stuff is really important again. We want your hormones right. We want your B vitamins right. We want your vitamin C levels elevated. So good multi, and you want some zinc, and you want some fish oil, and then always have on hand now the elderberry and the things we've talked about before.
Okay. This person had their first vaccine in April and never got the second one. Is it too late to get the second one? If they do, is it as effective? Are they kind of starting over?
So the first thing is, if you're under 70, the first vaccine is going to give you almost always outstanding immunity, unless you're in the 5% who have an immune defect. But yes, you get your second vaccine to meet the criteria set. I always have people do 2 vaccines to meet the criteria set for travel if it's Pfizer or Moderna. I don't believe scientifically it matters for immunity, but to hit the check mark, you do 2. But if you look at that data, it's very clear that for people under 70, they're going to hit it 95% of the time with 1. And so, yes, we encourage 2 because I followed the recommendations, but from a science point of view, 1 is everything, and that's why I think our focus is to get everyone vaccinated once. And that's going to have the greatest impact. And the second vaccine may be additive, but the first one's the one that does it.
So this person got their second.
And I have a parenthetical conflict. And just as a side, and people who are younger have only gotten 1, we've checked their antibodies and they've been sky high. So for various reasons, they've not wanted to get the second one. Sometimes it's pregnancy, something else. So we've checked, and so far, as expected, their antibodies are sky high.
So with the sky high antibodies, this person's had 2, both of the vaccines, has come to your office, had the antibodies checked 4 months later, they were still super high, but now they're starting to get worried again. Should you continue to check your antibodies?
No.
If so, how often?
So we're going to go through this.
No.
I'll go through this again for everyone. So think of the antibody as the baton in a policeman's hand. And I know this isn't a perfect analogy these days, or metaphor, or analogy, whatever I'm doing. And they're batting the rabid dog instead of a criminal. Pat, 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 pat. So, and they beat up the rabid dog, and then the people take it away and do whatever they do with it. But that baton, or the antibody, is the end point of your B cell immune response. So the reactive B cell is the policeman, okay? So then the policeman calls the police station, tells the police station what happened, the dog owner, blah, blah, blah. And that's your memory B cell. And then eventually, so that starts to memorize it long term. And then the police station sends its monthly report of all crime to the FBI. And the FBI is your bone marrow germinal B cell. That's where your immune system is. That's what gives you immunity. It's not the freaking antibody. That doesn't give you immunity. The antibody is what attacks the virus. It's the immunity is stored in your bone marrow. And it's the exact same thing with T lymphocytes, only they're in the thymus. And so you have natural killer cells. When you get re-exposed to an antigen, it takes 3 days for your antibodies to really start mounting a response, 72 hours, and the levels are up at day 4 to 6. How long does it take your T cells? Because you have natural killer T cells around all the time that are programmed, and they're quick reacting. It's 6 hours. So don't get flummoxed about your antibody levels. It's not what's important. It is do you have an immune system that will store this and give you immunity? And the answer is you will 95% of the time. And there's all these papers and people, I mean, again, from Fauci's own divisions showing this. So that's what I can tell you. And I'm not frustrated by it. It's just since they won't talk about it, everyone gets it's all manipulation. Doing a third vaccine, they've come out multiple times in the last week saying there's no purpose, because his own division has shown there's no purpose, because you either have the immunity or you don't, and it's not going to be 95%. Now, they don't put it quite like that, but essentially that's what the papers have shown.
You've already answered this pretty much, but if you've had the vaccine, should you still be on zinc?
I think you should now be on zinc, back on zinc at least 2 to 3 times a week. With food, always with food.
How sick are the new cases? And I'm assuming they mean with the new variant.
So with the Delta, the people are getting sicker if they haven't been vaccinated. If they've been vaccinated, there's a massive reduction of serious illness. Again, the current data just out of Israel in the last day or two is 93% reduction in serious illness. Classically, we're at about a 99.99%, but that's just the preliminary report. So if you look at who's getting sicker, it is the people who haven't been vaccinated, and there is maybe a shift towards more of them getting sicker.
What should people do, the people that can't get the vaccine for like medical reasons?
If you can't get the vaccine for a medical reason, you want to be tip-top with your immune system. You need to talk to your doctor about strategies for prophylaxis. We have several people we prophylax who have failed the vaccine because they were on immunosuppressants, or can't take a vaccine because they've had an adverse vaccine event. Likewise, we have people who have gotten COVID who've not gotten the vaccine again because they had such vicious COVID. We don't want to reinstitute that, because we've had people get the vaccine who already had COVID, and one of them ended up, anyway, they got sick with COVID, so they got really sick with the vaccine. So we have a different strategy to augment them. But that's in our practice, because I understand, if you believe, I have a vision of what we need to do for these people, but not everyone does, which is okay.
So if you have already been diagnosed with Guillain-Barré, am I saying that correctly?
Not Guillain-Barré.
I don't know. Okay, with that.
So that's a neuropathy where I believe it's the Schwann cells that cover the nerves dissipate a little bit, and so you can't get nerve conduction, so you get muscle weakness, and if it's really bad, you can't breathe. So there's about 2,800 cases post-vaccine of that, which would be about what we'd expect. Could it be temporal? Yes. Could it be causal? Probably. So there's some mix of that, where some would have happened anyway, but some are from the vaccine, which is a small amount, but if it's you, it's 100%. So the question is, would you get the vaccine?
If you already have that, not because of the vaccine.
If you already have that, I would be concerned about getting the vaccine. That's me. I would not get, but that's me. If I have Guillain-Barré and I have total muscle weakness and have gotten really sick from that, I obviously have a trigger for it. And since something has happened to me to give me that in the first place, so if getting the vaccine could work out badly for me. But it's all about how you assess your risk. If you're not all that concerned about it, yes, you could get the vaccine. I would do a prophylactic plan for those people. But that's me again, because what happens if you got it really bad and you get your chest muscles get it and you can't breathe? Then you're in the intensive care unit. So again, that's a tricky situation. Thank goodness it doesn't happen to too many people that we have to worry about.
Okay. If we are already at herd immunity, why are the cases rising?
Because there's 2 reasons. One, some areas, like if you look at Oklahoma City, we're predominantly at herd immunity. I mean, you look at it's more than 1,000% increase on the eastern parts of the state, and it's because they didn't get vaccinated. So yes, there's going to be some reinfection now because we have a new variant. So I think the herd immunity was for the older one. Now we have a little bit newer one, so we have partial infections hitting people and getting them sick. So the herd immunity thing has altered somewhat because of the variant, but not completely. Did that make sense? Sort of. So the bottom line is, we have herd immunity in Oklahoma City for the most part. I mean, if we have essentially, a 1% less than a 1% total risk of getting severe illness across all groups who are vaccinated, we're fine. If we just get mild symptomatic stuff, that's not a big deal. The problem is when you go to places where there isn't the vaccination levels, they don't have herd immunity. Our community essentially has herd immunity. There's mild infections. We're not having this big pulse of hospitalizations from our community in Oklahoma City. We are getting hospitalizations from all these small towns, which is starting to fill up our hospitals again. So that's the problem. So the issue is the people who are not getting vaccinated in the small towns are the problem. Adults need to get vaccinated. Some people go, oh, we need to get the teenagers vaccinated, we need to get the kids vaccinated, that will slow the variant down. We need the adults vaccinated. We need the adults vaccinated. Adults, all adults should be vaccinated against COVID, unless they have a contraindication.
Okay. So this person,
And again, that's my view in terms of those who have not already had COVID. I think if you've already had COVID, it's a complex issue to get vaccinated.
okay, so this person
Because
has,
hold on, even Fauci said in his email back last year that you were immune, but he won't say it now. But that's, for those of you who love Fauci, I just want to throw him a bone on that one.
okay, so positive COVID, lost taste and smell. It's been several months. I didn't write it down. I think they said 7 months. Got the vaccine. Still doesn't have taste and smell. Could getting the vaccine have prolonged that?
Absolutely.
And do you have suggestions on what to do to get taste and smell back?
Because the vaccine, if you look at this great paper which I posted, there's for systemic effects, if you've already been vaccinated, or already been infected, the vaccine has about a 2,000% increase in systemic effects blended compared to non-infected people. So yes, it could make it worse. We do a bunch of things for that, like I've talked about. It's nutrition, it's ozonation of the blood, and again, these are restorative things to get your body to heal yourself. We're trying to get you to heal yourself. That's the key thing. And so there is no medicine to give you your sense of smell back or taste. It is about making your body heal yourself to regenerate and restore function. So yes, we do address that, and there's things we do like I've talked about.
Okay. Did you talk about the VAERS? I think you did.
So no, I did not.
Okay.
So another question was the vaccine adverse event reporting system. So I have it right here. So this is, there. You can go online and look at that. That's the data bank on all the vaccine adverse events. It can be helpful if you can interpret it, but just because there's an adverse event, like I was reading through some of them, one guy had developed severe shortness of breath, got hospitalized, was super sick 3 months after his vaccine, but the thing then they go through it thankfully and they go, but 3 weeks before he'd been admitted with fluid in his lungs and mild pneumonia, and he ended up having adenocarcinoma of his lungs. He has a prior 30-year history of chronic obstructive pulmonary disease, and he's elected not to do any chemotherapy or any treatment for his lung cancer. So they report, so he was in for his lung cancer complications that is untreated, not from the vaccine. But within the mix of those, there are things that are most likely potentially from the vaccine, but there's a lot of things in there that are not from the vaccine. And then the other question was about the Isreali stuff that we had. So first, there's a question, what was it, antigenic priming? I always call it
pathogenic priming.
Pathogenic priming. So the thing people worry about with vaccines, do vaccines, if you give a vaccine, prime your immune system to miss then an infectious agent? And so that's called original antigenic sin. So by its very definition, your first vaccination gives you original antigenic sin. It means it sets your immune system up to fight the virus. The Pfizer, Moderna, Johnson & Johnson, and AstraZeneca, and the Novavax, which hopefully will be out soon, all were part of the conference where they were specifically designed and tested to avoid any antigenic masking or making it so your immune response would miss a viral infection. The Chinese and the Russians, and I don't know if the Indian vaccines participated in that, but the Chinese and Russians did not. So, and that's my criticism of flu vaccines, is clearly they do this antigenic masking or priming, so you will miss, your immune system will miss the virus. I'm not concerned about that at all with the main vaccines, because they've specifically addressed it in their formulations and testing. So that's the first thing. Or was that the main thing with the Isreali?
That was his main question.
The main question. So I'm not concerned about that at all with the prior vaccines. Now my concern is if you start getting boosters, could that happen? And the answer is yes. So that's why I'm very concerned about it, when we don't think adding a booster will improve anything. So again, I think we have to be patient. We have to believe this is going to pass, but the solution to get this to pass, I'm sorry this is so long, is we need to get non-immune adults vaccinated, because that's how we stop further mutations. So that's it. Hope that was helpful. Sorry it was long, but was answering questions. Good night.